Pakistan's healthcare. What is its future and why does it matter to us? Questions to ask about Pakistan healthcare include who needs access, who pays, what are the main health issues, and what is and should be done. The population of Pakistan is 222 million users approximately. Now, about 25% are below the poverty line and are deprived of basic human necessities. That's a lot of people. Now, how can healthcare be stable when even the government is unstable? Recently, President Alvi and Prime Minister Khan were asked to step down. This contributes to a lack of consistency that could help get people the care that they need. Now, the percent of GDP spent on healthcare in Pakistan yearly is 0.42%. That is less than 0.5% of their national GDP. Now, compare that to the American percent, which is 8.3% of its GDP on healthcare. And people still think that America needs to spend more on healthcare as well. 78% of the population pays for healthcare out of their own pocket. We know that prescription prices and care prices are exorbitant and are on the rise as well. Notice here that the graph shows the amount and type of spending on healthcare, and most of the spending is out of pocket, the majority there, and that is followed by the spending of the government for healthcare. Now, who pays? Now, there is care available to all technically, but it is not the greatest care. You would need to go to a public hospital to receive care. There's overcrowding, hygiene standards are compromised, low funding for equipment and supplies, counterfeit medications, long wait times, few staff, and of course corruption, so that the money doesn't get quite where it needs to go for the health care. Now, in the private sector, private care is available to those who can pay exorbitant charges. There might be slightly nicer facilities and supply availability, slightly shorter wait times, although they are still very long. 75% of all services in Pakistan are provided via the private sector. Many health issues go untreated in Pakistan due to funding, finances, the type of care needed may not even be available. Mental health is not a priority in Pakistan. Men in the family may choose the level of care for women and children, and of course, abuse could be an issue as well. Imran Khan does care about the welfare of the people. He says, although change in care can take decades to improve, he is trying to help. In interviews I watched, he seems to truly have compassion for those who are suffering. The more recent healthcare changes for the low-income sector that recently went into effect hit a few bumps when the funding was promised but did not fully arrive, and that was a big disappointment. Most health issues are preventable that are occurring in Pakistan. Maternal deaths, lack of nutrition, disease due to bad lifestyle, increasing hypertension, depression and mental health, and failure to eradicate something as simple as poliovirus. Pakistan is considered a third world country, and these are the top 6 issues, but on the rise also are diabetes, cancer, health problems, and a lot of these things come from air pollution, noise pollution, and water pollution. Now, with the recent COVID-19 pandemic, Imran Khan has been aiming to tackle coronavirus as smoothly as possible. He's caught some heat for it. He's trying to keep the economy running. He's trying to control hunger, ensure relief to the weaker segments of society, and keep the people's all-around well-being a priority. What can be done about Pakistan's healthcare? What is its future? Now, it does seem that Imran Khan is seeing that more money needs to be allotted to healthcare in Pakistan for quality care, facility funding, healthcare workers and staff, including medical doctors and psychiatrists. Now, a standard for medicines would also greatly improve function, safety, quality, and accessibility and effectiveness of those medicines. One thing close to my heart is mother and child care and education with unified standards of care. Mothers and children would greatly benefit from a united standard of care. And it may seem like a simple approach but it would prevent and eliminate problems that include malnutrition, low birth weight, and disease. The care of the home starts with the care and knowledge of the mother. Basic sanitation. Several problems that Pakistanis face are due to lack of knowledge about basic sanitation and health education. As people become more educated, they also take care of their health at a higher standard, so that is always a plus. Now, even improving knowledge of basic water sanitation could improve communicable disease transmission by an immense amount. UNICEF estimates that 3.5 million children were at risk of being affected by waterborne viral and infectious diseases even within the last decade. And these are things that are very easily preventable. Two things that are coming on the horizon, and they're just starting out in Pakistan, are telemedicine visits and health tourism. A telemedicine visit is just a visit via phone or something like a Zoom meeting. It's a remote service that doctors and nurses can offer. The problem is that there's no regulatory umbrella there, so you may not get the same or consistent care or good care when you're doing a telemedicine visit. Health tourism is when people that had lived previously in Pakistan or coming to visit for medical care can get less expensive private care and surgeries. And one plus is that it has shorter wait times than the UK, so that is a draw for people as well. So why does this all matter to us? Robin Warren stated that if affluent countries like the United States fail to manage global health problems better, in another 50 years, the world could have more levels of infection than 100 years ago. So he also stated that infectious diseases, including those that are now resistant to standard antibiotics, can spread across all nations in today's era of global travel and migration. He says, I think the American government should be prepared to buy drugs and give them to poor countries because the poor countries cannot afford to pay for them. The American government, for the good of America, could get diseases treated more efficiently. If the rich countries help the poorer countries, they are helping themselves. Global transmission of diseases may have sounded like science fiction in previous times, but as we have learned with COVID-19, one country's transmission to those around the world can take only a minimal amount of time. With travel and trade, the rates of infections can happen very rapidly, and Warren warns that health problems are not limited to geography. In conclusion, the future of Pakistan healthcare is brighter than it has been in the past. It does have many hurdles. There is also some optimism there, especially in recent days with leaders that are trying to bring health to the top of the never-ending pile of to-dos and concerns that a country like Pakistan has. One question remains, should more affluent countries help with disease eradication in poorer countries like Pakistan? I do believe that as we rise up and help others, that we all rise.